Okay, so this one is on blood pressure and cardiac output. Blood pressure is basically the measure of pressure of blood in your arteries. Normal blood pressure, while they're kind of adjusting the numbers a bit these days, it was always taken to be 120/80, and the units are given in millimeters of mercury. Hg stands for mercury. Okay, so if you would go to the doctor's office, they used to have this big contraption in the corner where it had a column of mercury that would go up and down if they used the old-fashioned kit for measuring your blood pressure. The instrument that used for measuring your blood pressure is called a sphygmomanometer. Yeah, say that 5 times fast. Sphygmomanometer. Okay. Basically, the first reading that you get is called the systolic pressure. It is higher, and it is a measure of when your ventricles contract. So that makes sense. If your ventricles are contracting, then it's going to be a lot of pressure going out through your arteries. Okay? The second reading is called the diastolic pressure. It's the lower number, and it is showing when the heart relaxes. So it's really important that that second number goes down, because if it stays up higher, then it kind of is saying, okay, your heart's not able to relax very much. Okay? So, normally whenever we used to go and get our blood pressure taken, they would use a blood pressure cuff, and it might have a gauge right on it, or it would be connected to the big thing in the corner of the office that had the mercury bar of mercury the column of mercury that would go up and down. The doctor would listen with a stethoscope. Okay, because basically what they do is they put the cuff on and they increase the pressure in the cuff. So they inflate the cuff in order to close off the artery that's in your arm. And then they'll slowly release the pressure and they'll listen. Okay, so when they hear that first sound, when they first hear your heart beating, that is when they take the first reading. Okay, so they fill it up so that there's more pressure than what they think that your higher number would be. Okay, so they'd put it up to say 150, and then they'd start to release the pressure, and that first time they hear a sound, they would take note as the first number in the blood pressure reading. That's the systolic pressure. Okay, they'd release it some more, and then once the sound disappears, then they would call it then they would record the second reading, which is the diastolic pressure. Okay, so that is measuring blood pressure. Some factors that affect blood pressure. So if you had a diet that's high in salt, they usually say to kind of reduce your salt intake. Don't make it so you have absolutely none, because it is important that you have a certain amount for your proper nerve function and things like that. But if you have too much, then you'd probably feel kind of a bit puffy, because you're going to basically, water is going to follow the salt. So if you have a lot of salt in your blood or in your body tissues, then the water is going to follow, and it's going to make you have a higher blood pressure if it's in your blood vessels. Okay, so it increases your blood volume, and then it causes more pressure against your blood vessels. Similar, if you have a diet high in cholesterol, cholesterol causes clogging of your arteries and makes it less elastic and narrows your vessels. So it's harder to get stuff through your vessels, so it makes a higher blood pressure. If you have regular use of artificial stimulants that increase your heart rate or constrict your blood vessels, okay, then that can also increase your blood pressure. Okay, if your heart's beating faster, then it's going to cause more pressure against those blood vessels. Or if your blood vessels are constricted, then it means that your heart's going to be still pumping that blood through, but if your vessels are smaller and narrower, then it's going to be a higher pressure going through there. So things like caffeine in coffee, or nicotine if you're smoking cigarettes or whatever, and alcohol, they can all affect your blood pressure. Heredity is also one that affects blood pressure. In some of us, we are born with higher levels of certain plasma proteins that can cause you to have a normally higher running blood pressure. Okay? Lack of exercise is a huge one. Okay, regular exercise is really important. We learned about how your muscle movements are important to keep regular circulation going on in your vessels, get the blood back to your heart and recirculate through your body. So it's really important that you get lots of exercise to keep your heart and your vessels healthy. Obesity, another that can cause increased blood pressure. Okay, if you are obese, then you have more cells to get oxygen nutrients to. Your heart probably has some fatty deposits on it, and it's going to be harder for it to do its job. It's got a lot more work to do, especially if you're not exercising and making your heart muscle strong. It's going to have a lot more work to do to try and get the blood to all the tissues. Your age too. Your blood pressure tends to increase as you age. Now that also depends on the other factors. If you are taking really good care of yourself, your nutrition is really good, and you're getting lots of exercise, then maybe it's not going to affect you as much as the person beside you who isn't. Those things that affect your blood pressure do so by altering one of these three things. Okay, so first thing that they might be doing is changing the width or diameter of your blood vessels. Okay, so they're changing the arteriolar resistance, we say. If they cause vasodilation, in other words, if they cause your vessel to open up more, then it would lower your blood pressure because it would be easier to push the blood through if your blood vessel is open wider. But if they cause vasoconstriction, then it narrows the blood vessel and makes it harder to pump the blood through, so it would raise your blood pressure. They may affect you by altering your blood composition. Okay, so if they make your blood thicker or have a higher volume, then it's going to cause your blood pressure to go up. Okay, so with salt, we said it causes water to come into your blood, so that would increase your blood volume and increase your blood pressure. Okay, if you have higher amount of certain proteins in your blood and they're thicker, your blood would be thicker and it would cause you to have a higher blood pressure. Okay. The third way is by altering your cardiac output. So cardiac just means heart, so your heart output. So they may alter your cardiac output by either altering your stroke volume or your heart rate. So stroke volume is basically how much volume you can push out of your heart with a certain beat. Okay, so in one beat, how much blood can your heart push out? If you have a stronger, healthier heart, then you can push out more blood in a single beat than someone who has a weaker or smaller or not as healthy heart. Okay, so if you have a larger stroke volume, then you're going to push out more blood, which is going to be a higher blood pressure, possibly. Okay. If you have a higher heart rate, then that means you're going to be you're beating your heart at a faster pace. Okay, so if you have a faster heart rate and you're forcing more blood out in a minute, then that can also increase your blood pressure. Okay, so this is just showing how cardiac output is calculated. Okay, so your cardiac output is basically the amount of blood that's pumped out of your heart in 1 minute. Okay, so volume per minute, basically. So in order to calculate it, you take your stroke volume, which is the volume that you can push out in one beat, and you multiply it by your pulse or your heart rate, which is the number of beats that your heart is beating in a minute. Okay, and if you like math, then you might like to see how your units cancel out. Okay, and you end up with the volume that you push out in a minute. Okay, so factors that can affect your cardiac output: your body size, Okay, if you are smaller, like a baby, then you're going to have a smaller heart and obviously smaller cardiac output. If you are bigger, you're going to have a bigger heart. Okay, but it also depends on other things too, not just your body size. Your energy needs. If you are running a 10K race, your energy needs are going to be much different than somebody sitting on the couch watching TV. Okay, so if your body is doing something that demands a lot of energy for your cells, then your heart has to work a lot harder. So your cardiac output is going to be higher. Your heart is going to be beating faster to try and get more blood to your tissues. Okay, also depends on your level of fitness. If you are very active, you're exercising a lot, then your heart is going to be healthier. And so your heart isn't your heart, if it's healthier, can put out more blood in a given beat because you have a stronger muscle. So you wouldn't have to beat it as many times as someone who has not as healthy a heart. Okay, if their heart muscle isn't as strong, then they would have to beat it more times in order to get that same amount of blood through. Typically speaking, an average person, so an average 70 kilogram person, pumps about 5 liters of blood in a minute. That's crazy. Now, this part can get a little bit hard to understand at times. Okay, so this is something else you might have to do a little kind of schematic diagram, which just means words, keywords, and arrows to explain what's happening. So we're going to talk about a negative feedback mechanism that's important for regulating your blood pressure. So, if you have dealt with boats or sailing or things like that, you've probably heard of a barometer before. Okay, a barometer is basically an instrument that's used to measure pressure. In our bodies, we have something called baroreceptors. Okay, baroreceptors are receptors that detect pressure, blood pressure. So they're blood pressure sensors that are in our carotid arteries, okay, and in our aorta. So it's really important that we can detect our blood pressure right away and be able to regulate it, get back to a healthy blood pressure if we need to. Okay, so they detect an increase in blood pressure and they send a message to a certain part in your brain called the medulla oblongata. And that's a really important part of your brain. It is it's your life support part of your brain. It is the part that if it isn't working properly, then they would have to put you on life support system. So it controls your breathing, it controls your heart rate, it controls a lot of those involuntary things that you don't think about but that keep you alive. Okay? The control that it offers is through the sympathetic and parasympathetic nerves. Okay, and this is showing down here, it shows a picture of the medulla oblongata. Okay, it's kind of at the base of your brain stem. It's part of your brain stem. So if you had an accident and they said, there was damage to the brain stem, then there's unfortunately a very high chance that you might not be able to recover. Okay, so how does the body respond to an increase in blood pressure? So we have those 6 things that we're going to look at. First is the perturbing factor. So let's say in this case you exercised. Oh my goodness, yes, it's a perturbing factor. Because when you exercise, it causes your blood pressure to increase. Okay, it causes your body to realize, oh, the cells are going to need more energy. I have to make my heart beat faster. Okay, in order to get lots of blood and oxygen and nutrients to my cells so they can do this exercise thing. Okay, so it causes an increase in blood pressure, which is a stimulus that is detected by your baroreceptors, the sensors, the special sensors in your carotid arteries in your aorta. Okay, they send a message to the medulla oblongata, okay, in your brain. That's the integrating center, right? Your brain. The medulla oblongata then turns off the sympathetic nerves and turns on the parasympathetic nerves. Okay, sympathetic nerves are often like usually on, and the parasympathetic nerves only come on at certain times to kind of regulate other things. So they're like on-off switches. They kind of do the opposite things. Sympathetic nerves are the ones that actually, if we talk about fight or flight, they're the ones that cause your heart to beat faster. They cause your breathing to increase. They cause your pupils to dilate, and they cause you to have all these like when you feel your heart pounding in your chest, that's because of the sympathetic nerves. Okay, so if we want your blood pressure to decrease, okay, we want it to come back down, then we want to turn those off. Okay, it turns on the parasympathetic nerves, and these, or the parasympathetic nerves, are going to cause certain effectors, okay, your blood vessels and your heart, to respond in a way that will decrease your blood pressure. Okay, it causes your blood vessels to dilate. And we said if you make those blood vessels open up, they're wider, then it's easier to get the blood through, so that decreases blood pressure. It causes your heart to slow down. Okay, it decreases the firing of the sinoatrial node, which decreases your heart rate. Okay, the overall response is to lower your blood pressure. And when it gets back down to normal, then these dashed arrows are showing that it's going to shut off the earlier steps. Okay, so your blood pressure, your sensors and your sensors will be turned off, and your brain is going to be like, oh, it's back to normal. Don't have to do that anymore. Okay, let's see if the animation is working. Okay, so that brings us to the lymphatic system. So that is about it for blood pressure and cardiac output. If you have any questions, please make sure you ask. I don't mind meeting with you anytime.